Hey, have a good lunch. All right, ready to go back to work? Good. You gonna recall Mr. Thompson, or is there someone else you're gonna call now?
Someone else at this point, Your Honor.
All right, we'll call him, please, or her.
Dustin Blount.
Raise your right hand. Do you solemnly swear or affirm the testimony you're about to give involving this case is the truth, the whole truth, and nothing but the truth, so help you God? I do. Thank you.
Carson?
What is your name?
Dustin Blount
And where are you employed?
with the FBI,
And how long have you been with the FBI?
approximately 15 years.
Okay, and you're a special agent, is that correct?
Yes.
Okay. And prior to working with the FBI, where did you work?
With the Mississippi Department of Wildlife, Fisheries, and Parks,
And how long did you do that?
approximately 6 years.
Okay, so you've been in law enforcement about 21. You actually had another job before that, I believe, right? In law enforcement, or did you?
I did some time in the military,
Okay. What branch were you in?
Army National Guard.
Dustin, I want to take you back to December of 2014. Did the FBI, or were the FBI asked to assist in the investigation of the death of Jessica Chambers?
Yes.
And do you remember approximately when y'all became involved?
A week or two after we had heard about it.
Okay. And when you came in, were you briefed about the facts of what was going on and also some statements given by various witnesses?
Yes.
Okay. And as a result of the interviews that had been previously conducted, did you and another agent decide to re-interview Quentin Tellis?
Yes.
And where did that interview take place?
At Mr. Tellis's residence in Cortland, Mississippi.
Okay. And I believe that was on December 18th, is that correct?
Yes.
Okay. And when you got to the residence, was Mr. Tellis there?
Yes.
And did he agree to talk with y'all?
Yes.
Okay. And did you talk with him about his relationship with Jessica Chambers?
Yes.
And what did he tell you about his relationship with Jessica?
He said that they had a good relationship, that it wasn't too long before the interview that they had actually met one another, but that since the time that they had met, they had developed a good friendship.
And could he give you an approximate time frame of when they had met or before her death?
I believe he was introduced to Jessica around Thanksgiving.
And did you or did he at any point in time talk to you about having sex with Jessica?
Yes.
And what did he tell you about that?
He stated that he had had sex with Jessica one time, and that it was just south of his residence, not far from where the interview was taking place. And the sex had occurred in Jessica's vehicle, and they had both gotten in the passenger seat. Mr. Tellis was sitting in the passenger seat with the seat reclined back. Ms. Chambers was on top of Mr. Tellis, completely undressed. She was naked, and they had had sex that one time in Mr. Tellis' side yard. And that's the only time that he mentioned he had had sex with her.
Now, they just left from out there. As you're looking at Quentin's residence, the side yard that you're referring to, is it the drive that is next to Quentin's drive?
Yes, if you're facing the house from the highway, it'd be to your right. It's a small driveway, or it's been a while since I've seen it, but a gravel road that goes to the right, just to the south of his house.
And did you also talk to him about transportation that he might have?
We discussed that, yes.
Okay. Do I now?
Yes, we discussed transportation.
Okay. And did he indicate to you that he had some kind of a dirt bike?
Yes,
Okay. And did he indicate to you where he kept that dirt bike?
he did.
And where was that?
There's a white shed out in front of their residence, closer to the highway, and on that day, that's where the dirt bike was kept, and he walked with us out to the shed to show us the dirt bike.
photograph. Tell me if you can identify that, please.
Yes.
And what is that?
It's a picture taken from the highway of Mr. Tellis's driveway, which shows his residence and the shed that we're referring to.
Your Honor, I would offer this as an exhibit, this witness testimony.
Any objection?
No objection, Your Honor.
There no objection, be marked as an exhibit.
That will be number 30.
You said, June.
30.
Did you ask him, or did he tell you about driving Jessica's car? Did he indicate to you, or excuse me, did he indicate to you that they had gone to a liquor store?
Yes.
And who did he indicate drove?
I believe Jessica.
Okay. And was the liquor store open or closed?
It was closed.
So when you were interviewing him on December 18th, he told you that Jessica drove to the liquor store.
Yes.
Okay. And did he indicate to you how many times that he had ridden with Jessica in the vehicle?
It was just several times. If I can refer to my notes, I could be more exact, but he mentioned that from the day he met her until the date that he had heard the terrible news of Jessica, that they had been together 3 or 4 times.
And when you asked him, well, and let's move on just a little bit, when you asked him about the day that Jessica died, did he indicate to you whether or not he could remember what happened that morning?
Initially, his answer was no, and then later in the interview, he recalled a few details of that morning.
Such as, do you remember?
Morning of December the 6th. Can I refer to my notes to be more accurate to the jury? On Saturday morning, December the 6th, he stated that himself, Keisha Meyer, who was a mutual friend of Mr. Tellis's, and Ms. Chambers, that the 3 of them rode around the Cortland area in Jessica's vehicle. Jessica had picked up Tellis from his residence, and then they drove to the Shallow area to pick up Keisha. Jessica and Keisha rode around and smoked marijuana while in the car in the Shallow area. Tellis recalled Jessica saying that she had to work the following day. The following day was also Keisha's birthday. After Jessica and Keisha finished smoking, they dropped Tellis back off at his residence.
Did he indicate to you whether or not he saw Jessica again that day?
He stated that later in the day, Jessica contacted him and was asking for some money, but that she never came to get it, and that he did not see her again that day.
And this was the 18th of December he was telling you these things?
That's correct.
Okay. What did he tell you about learning about Jessica's death?
He had just returned from Batesville, and he had seen a lot of police activity in the area. So he stated that when he pulled in his driveway from a trip he had made to Batesville, that he placed his keys in the house, walked across the street to the gas station, I believe it's known as the Gurley's gas station, and he asked people at the gas station what's going on, and someone mentioned to him that Jessica Chambers had been killed, and he asked who had done it, and he heard from an individual that Roscoe had killed her and that he had already been picked up by law enforcement.
Did you talk to him about his trip to Batesville earlier in the evening on the 6th?
Yes.
Okay, and where did he go first to when he went to and what was the reason he went to Batesville?
At a previous date, while Mr. Tellis was incarcerated, he had met a female who lived in Louisiana, and according to Mr. Tellis, was in communications with her around the time of December 6th, and he wanted to go to Batesville to wire her some money so that she could travel from Louisiana to Mississippi to see him.
And what was what was the method of sending the money?
Okay. He went to get to send it Western Union, but the Piggly Wiggly was closed here in town, so he went to Fred's and purchased a Green Dot card, and I believe it was a $40 Green Dot card, and he purchased that card at Fred's, and then he was returning home from that trip when.
What is a Green Dot card?
It's kind of like a bank card you can put money on, or that has money. You give the number to someone and they can retrieve the money.
Okay, similar to Western Union.
Similar, yes.
Okay. And did you actually travel to Batesville to determine whether or not he had been at either one of those places?
Yes.
Okay, and did you in fact go to the Piggly Wiggly first?
We went to Fred's first.
Excuse me, Fred's first.
Yes.
Okay, and did you review the video system there at Fred's?
Yes.
Okay, and were you able to find Mr. Tellis on the video?
Yes.
And did you in fact, or were you able to retrieve a photograph, or did you take a photograph from the video showing him in the store?
We did.
I would hand you a photograph and ask if you can identify that, please.
I can. That's a photograph that was taken from the monitor at Fred's, the surveillance monitor. Once we, rewound the footage to the date and time in question, we identified Mr. Tellis checking out and leaving Fred's, and that's a photograph taking of the monitor.
Your Honor, I would offer this as an exhibit to this witness's testimony.
No objection, Your Honor.
All right, being no objection, be marked in video.
Justin, we'll take you back just a moment. You said that you talked to him about the dirt bike. Is that correct?
Yes.
And where was the dirt bike located?
It was out by the shed in front of the house.
And while you were at the shed, did he show you anything else?
Yes.
And what did Quentin show you at the shed?
A 5-gallon gasoline can.
Okay. So he showed you a gasoline can in the shed in front of his house.
He did.
And did you finally, before you ended the interview, ask him about text messages that he had with Jessica?
Yes.
And what did he tell you he had done with the text messages?
Since her death, he had deleted them from his phone.
And did he tell you when he did that?
He did. He stated that it was a few days after her death.
Nothing further, Your Honor.
Cross?
Officer Blount, you actually interviewed Mr. Tellis on how many occasions?
One time.
Just once. And that would have been the interview that took place December the 18th, 2004, I believe.
2014, yes.
2014, excuse me. Would that be the only time you interviewed him?
Yes.
Who else was present at that interview?
FBI Special Agent Justin Nedzwicki.
Neswicki?
Yes.
And Mr. Tellis was at home when you interviewed him. Is that
Yes.
correct? And how did you come to be at his home on this particular occasion?
How did I get to his house? How did we get to the interview?
No.
What was your question? I didn't-
I'm aware of the route. I'm saying, how did you end up going out? Was this something where you called him on the phone and scheduled
sorry.
it, or did you just show up at his home?
I understand. Since we were a week into the investigation, other law enforcement officers had briefed us on who they had talked to, and we mentioned that we would like to go, and he had been interviewed by someone else, and so we said we'd like to go and talk to him again. And so they told us where he resided, and we went down there to interview him.
Okay. So you came to his home here in Cortland to interview him, you and Agent Neswicki,
That's right.
and he was at home at the time.
That's correct.
And you went to his door. Was he in the house or was he outside when you got there?
I don't recall.
Okay. Did he talk to you voluntarily?
Yes.
Okay. And did he indicate at all that he didn't want to speak with you?
No.
He voluntarily answered all of your questions that day?
Yes.
Did he refuse to answer any of them?
Not that I'm aware of, no.
Okay. Now, you talked about him having sex with Jessica Chambers
Yes.
and how that sex took place in the driveway next to the home.
Yes.
This was consensual sex?
I'm not sure. The description I gave was what Mr. Tellis told me.
Right. And did he indicate to you during that interview that he had forced himself on Ms. Chambers during that time? I believe you indicated that he was in the vehicle and she was on top of him.
That's correct.
And I'm looking at my notes here. He talked to you about the events of December the 6th, 2014, which would have been the date of Ms. Chambers' death, right?
The morning, we discussed things that happened that morning, and then he discussed later that evening when he found out about her death.
Right. Now, did I misunderstand you? You said initially when you asked him about it, he didn't remember? And then he, later on in the interview, he remembered some more details?
Yes.
Would that be accurate?
Yes.
And this would have been on the 18th, which would have been roughly 12 days after this incident took place involving Ms. Chambers, correct?
That's correct.
Now, he described to you his recollection of what had happened on this particular day, correct?
Yes.
And I believe you testified that he heard about it when he got back to Gurley's store, and some people were talking about it. Is that correct?
Yes.
And you said he heard that Roscoe had done it and already been picked up.
That's what he said, yes.
Did you know who Roscoe was?
I did not.
Okay, do you know who Roscoe is?
I vaguely remember the name, but as I said here, I do not remember who he is.
Okay. Your report doesn't seem to reflect anything on that. Is that a lead that you all ever followed up on?
I can't recall 4 years ago. I'm sure someone investigating the case did, but I don't recall Roscoe's true name.
Okay.
And I didn't know it at the time of the interview.
Okay. Did you ever inquire as to whether or not a Roscoe had in fact been picked up?
I don't remember.
Okay. Now, you talked about this dirt bike that Mr. Tellis had.
Yes.
And you've got your notes there. What did Mr. Tellis describe to you concerning this dirt bike?
He mentioned that he uses it for transportation.
Okay. He rode around with it? Or he rode around on it?
That's right.
Okay. And where was the dirt bike? Did you actually see the dirt bike?
Yes.
Where was it?
It was right at the door of the shed when you walk into the shed.
Okay. Now, you've been out to that area, correct?
Yes.
And there's a door on the front of the shed when you're turning in from the highway. And then after you go through past the shed, there'd also be a door on the backside that would actually be closer to the trailer. Are you aware of what I'm speaking of?
I'm not.
Okay.
I'm aware of the shed and the front door. I'm not aware of the rear door. No.
Certainly. My personal witness, Your Honor?
You may.
Agent, if you will, take a look at that. That is a picture of the shed and the home. You testified that the dirt bike was actually sitting by the shed.
Yes, by the door right here.
So it was actually sitting in the front of the shed.
That's correct.
You could actually see it when you came in from the highway.
Yes.
Okay. Just wanted to clarify that. Now, you talked about a gas can. Where was this gas can?
It was in the shed. I believe it was when you opened the door.
Yes, sir.
That I was referring to. The gas can was towards the back of the shed.
Okay. Was there, how did you all become engaged in a conversation concerning a gas can?
I don't recall, other than the fact that we did ask about his motorcycle, the dirt bike, and he took us to show us the dirt bike. And while we're discussing the dirt bike, we asked him about the gas can, or he showed it to us and said that that was his gas can.
Sure. Well, you said the gas can was actually inside the shed.
Mm-hmm.
So were you inquiring as to the gas can, or did Mr. Tellis say, "Oh, I got a gas can sitting inside here. Would you like to look at it?" How did that take place?
I don't remember. I don't remember if the door to the shed was already open. I just can't remember
Okay.
every detail of it.
Did
I just
you-
remember seeing the motorcycle the dirt bike, at the shed, and seeing the gas can in the shed. I know we did look in the shed, and I don't recall if it was already opened or if he opened the door. I don't
Certainly.
remember.
Did you do an inspection of this gas can?
No, nothing other than observing it.
Did you confiscate the gas can?
No.
Did you do anything with it?
No,
You just looked at it?
just looked at it.
Okay. Was there anything unusual about this gas can?
Not that I remember.
As you sit here today, do you remember anything else that you may have seen when you looked inside this shed? The gas can sticks out.
Yes, the gas can's what we talked about, yes.
Okay. Now, you talked about Mr. Tellis and his involvement with Ms. Chambers. Do you recall that testimony?
I'm not sure what you're referring to.
Your notes indicate a time frame during which Mr. Tellis would have met Ms. Chambers.
Yes,
Do your notes indicate when he actually met, or roughly?
I believe it was around Thanksgiving.
Okay. And Thanksgiving of 2014?
Yes,
And he met her through Keisha Meyer.
that's correct.
So according to the information you derived in your interview, Ms. Myers introduced Mr. Tellis to Ms. Chambers.
That's correct.
Okay. Now, you also talked about him riding in the car with her. You remember that testimony?
Yes,
Did you all talk about an event where he actually took Ms. Chambers to the emergency room?
Ms. Chambers and Mr. Tellis did go to the emergency room.
Okay. Do you recall why they were at the emergency room?
Yes, Ms. Chambers felt like she had a cold and she wanted to go and get treatment. And so they drove to Batesville to the hospital to see a doctor.
And was there anyone else with them during this trip, based upon your investigation?
No,
So Ms. Tellis took Ms. Chambers to the ER to get medical treatment.
Yes, my notes say that Mr. Tellis rode with Jessica to the emergency room in Batesville.
Okay? And it indicated that he waited in the ER while she was getting treatment.
That's correct.
And this was just a couple of days before December 6th, wasn't it?
It was 2 or 3 days before her death.
Okay. Now, he advised you also that he had ridden in the car with Miss Chambers on only 2 occasions. Is that correct?
Repeat the question, please.
Okay. Mr. Tellers informed you that he had been with Miss Chambers in her car on 2 occasions.
He informed me that he had only been to Batesville on 2 occasions with her, but that they had ridden other times in the Cortland area. But on
Okay.
2 occasions, he said that only on 2 occasions did they actually travel to Batesville together.
Okay, so they traveled to Batesville on 2 occasions,
That's correct.
but they have been in the car on numerous occasions in the Cortland area.
Yes.
Is that correct?
Yes.
Okay. My personal witness, Your Honor.
You may.
Ask you a couple of questions about that. Agent Blount, that picture has been marked as an exhibit to your testimony. You actually took that picture, did you not?
Either myself or Agent Nedswicki did, yes.
Okay. And that picture was taken off of the surveillance system located at a store here in Batesville, was it not?
Yes.
And what store was that?
Fred's.
Fred's. And did you, other than taking that picture, did you do anything else, or did you inspect that surveillance system any farther than taking that picture?
In reference to what type of inspection? I mean, I'm not understanding your question. Yes,
Well, let me say it like this. You went to that store, Fred's, on this occasion, and you were looking for evidence to corroborate what Mr. Tellis had told you during that interview. Is that correct?
that's correct.
You took a picture of Mr. Tellis in that red hat and outfit there, correct?
Yes.
Did you do anything else other than take that picture, is my question.
And we utilized their hard drive, if you will, and had a manager show us how to do it. And we went to the time and date that Mr. Tellis said he was there and used the surveillance machine, if you will, to find Mr. Tellis at that time that Mr. Tellis said he was there. And then we took a picture of it, and that's the extent that we did.
So Mr. Tellis told you he was there. You went to the store, looked at the surveillance system, and that confirmed what he told you during that interview.
That's correct.
So what he told you in that regard was accurate.
That's right.
Would you have any reason to believe that the other information that he told you during this interview was inaccurate?
Object, that causes speculation. Sustained.
Mr. Blount, when you were questioning Mr. Tellis during this interview, okay, with your years of law enforcement experience, was your impression that he was being honest with you, or was your impression that he was being dishonest with you?
I didn't have an impression based on how early we were into the investigation. I didn't know many facts
Okay.
involved, so.
So you didn't have any...
I just know what he told me.
I'm sorry, I didn't mean to cut you off.
I just said I just know what he told me, and that's what we had when we left that day.
Were you able to verify any of the other information that he told you during this interview?
some things, such as he uses a motorcycle, and he showed us the motorcycle, and a lot of small factors involved. But as far as whether he was being truthful with us that day or not, led us further into the investigation, and the investigation continued. But as I sat there and interviewed him that day, I didn't know if he was being truthful or not.
Well, I understand that, Agent Blount. My question was this. Mr. Tellis told you many things on that day, and you testified as to this one particular fact. You and I assume Agent Zeswicki went to Fred's in Batesville to verify whether or not he was telling you the truth. So we know you verified that one fact.
That's correct.
Now, he told you a bunch of other things. He told you some things concerning Ms. Chambers. He told you some things concerning his whereabouts. My question is, did you personally verify any of the other facts that he told you during this interview, as you did with this?
The only involvement I had with Mr. Tellis was the day of this interview, and
Okay.
beyond that, it would be other agents involved in the case.
So out of the information that he conveyed to you in the interview, the only fact that you verified would have been the one that's reflected in the picture, which would verify that he did go to Fred's on that particular occasion.
That'd be accurate.
Okay. That's court's indulgence.
Yes, sir.
Agent Blount, are you aware of any other agents that may have worked, any other FBI agents that may have worked on this case? Other than the agent that you named that was with you on this particular occasion?
Initially, our entire office came to Batesville to help out, but to the extent of what other agents did, I'm not sure.
Attending the witness, Your Honor.
Redirect.
Dustin, just so the jury will understand, the FBI played an assist role in this case, is that correct?
That's correct.
And as far as Quentin Tellis is concerned, your only involvement with him was this one particular day.
That's correct.
As a matter of fact, during the course of this investigation, y'all received other information that led you into another investigation, is that correct?
That's correct.
And the focus of y'all, it being the FBI, went from the Quentin Tellis to this other investigation that began at that point. Is that correct?
Yes.
And did you provide the information that you learned from Quentin Tellis to other investigators?
Yes.
Okay. And that information was forwarded on for follow-up by other investigators. Is that correct?
That's correct.
Now, your other investigation was not related to this case. Is that correct?
No.
Okay. Now, I want to just make sure I understand, because I think Mr. Peterson asked you about this. When he said he had sex with Jessica, where were they? Physically, where were they? Or where was the car parked?
They were inside the car, and the car was parked in Mr. Tellis's, on a road in his side yard. If you're facing the house, if you guys just went out there, if you're facing the house, the road would be to the right of the house. I believe it's the south end of the house. A road goes beside the house, and it continues back behind the house, and they were on that side road.
All right. And then inside the car itself, the sex occurred in the passenger seat. Is that what he told you?
Yes.
And what was the position of the passenger seat when he claims they had sex?
It was reclined back.
And finally, the gasoline, or did you see yourself the gasoline can inside the shed?
Yes.
And who pointed the gasoline out to you?
Mr. Tellis.
Okay. Nothing further, Your Honor. He may be, Agent Blount may be found excused.
Thank you, Agent Blunt. You found excused. Thank you.
We call you next witness.
They calls Angela Overton.
Raise your right hand. Do you solemnly swear or affirm the testimony you're about to give involving this case is the truth, the whole truth, but the truth, so help you God? Go right over there.
All right, Mr. Taylor.
Would you state your name for me?
Angela Overton
Miss Overton, where are you currently employed?
at Regional 1 in Memphis, Tennessee.
And a lot of us know Regional 1 as the Med.
Yes.
And now, where are you, what division of Region 1 are you employed in now?
I'm in recovery, trauma recovery right now.
And Region 1 is a trauma center, correct?
Yes.
What area of Region 1 Trauma Center were you, or the Med, were you actually working in on December the 6th of 2014?
I was working in Burn.
And how long did you work in the burn unit at the Med?
I worked there for about 8 years.
And I called you previously by telephone about testifying in this trial, is that correct?
Yes.
Did you immediately know the patient that I was referring to?
Yes.
Were you one of the main treating nurses for Jessica Chambers when she arrived at the Med on December 6, 2014?
Yes.
And who was the on-call physician that particular evening?
Dr. Van Fleet.
Was that Michael Van Vliet?
Yes.
And who is the director of the Regional Medical Center, or what it used to be, Region 1 now, or the Med?
Dr. Hickerson.
Is that William Hickerson?
Yes.
And how were you advised that the patient was coming in, or what condition were you advised that the patient was coming to the Med?
We were told it was a 90% patient, 90% burn patient coming in.
How do you prepare for a 90% burn patient?
Well, with that, we think about with airway, we have to go get a ventilator, wound care, we have to get everything for wound care, and also to put in lines. So we have to get everything to place lines.
When you say lines, does that allow fluids to get in the body?
Yes, vascular lines, yes.
You had received patients with 90% burns before, is that correct?
Yes.
Was this patient slightly unusual in what was the information, in her condition as you received it at the Med that night?
Yes.
How was that?
It was unusual because we were told that it was someone had done this to her. So versus like a house fire and something like that. So that was what was unusual about it.
And when Jessica Chambers arrived at the Med, did you meet her?
Yes.
And were you one of the nurses that took charge of her?
Yes.
And was she intubated at the time?
Yes, she came in intubated, but they had to change the.
When we say intubated, there are two types of intubation, is that correct?
Yes, the paramedics put in their tube, which is something different than what they use here at the Med.
Do you know what a King airway is?
Yes, it's just an airway that it goes to the larynx.
Does it go all the way down into the throat?
No, not all the way down.
Okay. And in order to fully intubate her, were y'all attempting to get all the way down into her airway so she could breathe?
Yes.
So did you take out the tube that was installed in the helicopter?
No, I didn't.
Okay. Did someone?
Yes.
Did you attempt to speak to Ms. Chambers?
Yes, we attempted to communicate with her.
Why did you attempt to communicate with Ms. Chambers?
Because sometimes, we were trying to see if she can at least communicate back. Sometimes they might could say yes, no, not, and we were trying to just come up with another means of communication since she couldn't
Explain
talk.
what you mean by that, another means of communication.
Sometimes we'll tell them, if you understand what I'm saying, blink your eye. Yes, once for yes, or twice for no, or we'll ask them to squeeze my hand if you hear what I'm saying.
Was she able to respond to any of your questions?
No, she wasn't.
Can you tell me, was there any type of sounds coming from Jessica Chambers that night?
No sounds outside of when they pulled the tube to replace the next tube. It was like she was trying to talk, but everything was like she was gurgling, like she had fluid in her throat.
She have extensive burn damage to her face,
Yes,
her mouth, her lips,
yes,
her tongue.
yes.
Did Dr. Van Vliet, are you aware that Dr. Van Vliet communicated with Dr. Hickerson regarding her condition?
Yes,
And was a decision made as far as how to treat Jessica Chambers on December 6, 2014?
yes.
Ultimately, what survival rate did she have when she arrived?
Her survival rate was slim to none.
And did Dr. Van Vliet advise you to put her on, is it comfort care?
Yes.
Would you describe to the jury what comfort care is?
Comfort care, when they don't expect the patient to live, we just make them comfortable, give them pain meds. You still give them fluids and everything. And as far as like the burn wounds, we just dress the wounds.
And you described that this was different in regards to the information you received before, prior to her arriving.
Repeat that question?
You described the tone was different when Jessica came in because of what you were advised before she arrived.
Yes.
You just stated that, correct?
Yes.
And explain to the jury what the atmosphere and the mood was with the nurses.
Well, it was very quiet. I think we were kind of in shock, and it's because of her age. She's just so young, and to think that someone had done this to her, and so we were just very quiet.
I believe it
sad.
resonated with you even more, is that correct?
Yes, at the time I have a daughter that was the same age. She was 19.
You just mentioned wrapped. What do you mean by wrapped?
You say wrapped?
You said you wrapped her. What do you mean by wrapped her?
Wrapped her dressings?
Correct.
Basically, we just wrap the burn wounds with Curlex and Ace dressing. Normally, we would use a medicated cream, but we didn't do that with her since she was comfort care. We just wrapped the dressings instead.
And was this also done to allow her family to come say their goodbyes?
Yes.
Your Honor, may I approach? Ms. Overton, I'm going to show you a single-page photograph. Can you identify that photograph for me?
Yes, it's a picture of Jessica Chambers. She's in the wound care that we did, which is the arms and the legs are wrapped in Curlex and Ace, and she has an extra dry dressing on the top.
And it's almost her full body except for her face.
Yes,
Got it.
yes.
Your Honor, I would offer this as an exhibit to this witness's testimony.
Any objection?
No objection, Your Honor.
All right, being no objection, be admitted.
Should be 32.
That's
while you and other nurses were tending to Jessica that night, did the doctors advise her family of her condition?
Yes, they did.
Did they advise her family that she was going to die?
Yes.
Did they allow her mother and her family to come in and speak to her?
Yes.
And did they have that opportunity?
Yes, they did.
And I believe you advised me that shortly, did you step out of the room while her mother talked to her?
Yes.
And a very short time after her mother was able to speak to her, her vital signs began to decline.
Yes.
Did Jessica Chambers pass away at Region 1 Medical Center in the burn unit that night?
Yes, she did.
Your Honor, I tender the witness.
Cross.
Good afternoon, Ms. Overton.
Hi.
You were considered the primary nurse on December 6th with Miss Jessica?
Yes, ma'am.
Okay. And it is true that she did arrive at the hospital with second and third degree burns, pretty much covering her entire body. You agree?
Yes, ma'am.
And would have been both front and back,
Yes.
yes, of her body. Do you have, may I approach the witness, Your Honor?
You may.
Just- May I approach, Your Honor?
Go, go.
Do you see where it says that Ms. Jessica was admitted to the hospital? That'd be 2200, you see that?
Yes.
Okay. So that would be about 10 o'clock,
Yes.
10 p.m.? Okay. Do you have any idea how much time it took her to get to the hospital from the scene? Would
No,
you
I
have-
don't.
You had no knowledge, okay. But we do know it was about 10 o'clock when she arrived there.
Yes, ma'am.
Okay. I tender the witness, Your Honor.
Redirect.
No, sir, Your Honor. I would ask Ms. Overton to be finally excused.
Ms. Overton, thank you for coming. You finally excused me.
Thank you.
We call your next witness.
Dr. William Hickerson.
Raise your right hand. Do you solemnly swear or affirm the testimony you're about to give involving this case is the truth, the whole truth, and nothing but the truth? So help you God. Thank you. Everyone record.
All right, Mr. Hale.
Would you state your name, please?
William Leslie Hickerson.
Mr. Hickerson, where are you currently employed, in what capacity?
I work in Memphis, Tennessee. I'm employed by the University of Tennessee Health Science Center and University Clinical, along with Regional 1 Hospital, as the director of the Burn Center, Firefighters Burn Center in Regional 1 Hospital.
And how long have you been with Region 1 Hospital?
Since coming back, sir, it's been since 2008.
And can you state your education and work experience in the field as a medical specialist in plastic surgery and burns?
Yes, sir. Graduated from medical school in Memphis in 78. From 78 to 83, did general surgery residency and became board certified there. from 83 to 85, plastic surgery residency and board certified there. Started the burn center in Memphis in 1985 after finishing from my plastic standpoint, sir.
And have you been a plastic surgeon specializing in burns since that time?
Yes, sir.
Have you testified as an expert witness as a medical specialist in plastic surgery and burns in numerous courts in several states?
Yes, sir.
Have you also testified in this exact courtroom as a medical specialist in plastic surgery and burns?
Yes, sir.
Your Honor, at this time, I would tender Dr. William Hickerson as an expert in the field as a medical specialist in plastic surgery and burns.
Does the defense wish to voir dire Dr. Hickerson on his qualifications as an expert?
No, sir, Your
All right. Court will admit Dr. Hickerson is an expert in the field so offered.
Dr. Hickerson, you just stated you are the director of the burn unit at what we call the Med.
Yes, sir.
And on December the 6th of 2014, were you in that same capacity?
Yes, sir.
Now, were you actually at the hospital on December 6, 2014, that evening?
No, sir, I was not.
Who was the attending physician or that particular night?
Dr. Michael Van Vliet was my partner and was on that night, sir.
Were you contacted by Dr. Michael Van Vliet regarding a young female that had arrived named Jessica Chambers?
Yes, sir.
And did Michael Van Vliet describe to you the condition that she was in?
Yes, sir.
And did he also send you photographs of her condition?
Yes, sir.
And did you and Dr. Van Vliet have a discussion regarding her potential condition and her prognosis of survival?
Yes, sir, we did.
And can you describe for the jury what that discussion entailed?
We felt at that time the burns that she had sustained were such that she was not able to survive that injury.
And what type of burns were they?
She had third-degree burns, sir.
Over what percentage of her body would you
Well
say?
over 90%.
Given that percentage, were you and Dr. Van Vliet the ones who gave the order, as Ms. Overton just testified, to provide comfort care?
Yes, sir.
And are you aware that Jessica Chambers passed away that night at the Med?
Yes, sir.
When you say third-degree burns, as a burn expert, would you describe the severity of different types of burns at the body?
Yes, sir. When you look at the skin, you have two different layers. You have the epidermis and the dermis. Some burns involve only the epidermis. The second-degree burns are divided actually into two parts, a superficial second degree, which goes into the upper portion of that second layer, and a deep second degree, which goes into the bottom layer. And then you have third degree that goes all the way through, and then some people even include a fourth degree that would be into muscle or bone.
And when you mention third-degree burns, are third-degree burns what I call reversible?
No, sir.
Will they heal on their own?
Only the very small, that would be about the size of, small areas that would contract in and heal by scar. But anything that's the size of what is in this situation is not going to heal, sir.
And can you describe the process that the skin goes through when it sustains a third-degree burn?
Well, the process would be that, obviously, the higher the temperature and the longer the contact, the deeper your burn will be. So basically, if you're out in the sun, you're going to have a sunburn. But if you're in a very hot environment, it's going to go through that upper layer of the skin into the second layer and on down. So it basically cooks that skin, whether it is a flame burn or whether it's just an extremely high temperature that you're going to be involved with.
And is there a particular product or something that you would compare that skin to in regards to touch?
If you're talking about the third-degree burn,
Yes.
in this situation, a third-degree burn is very similar to leather. It's thick. It's nothing like what you assume to be your skin, where you can reach over, you can pinch it, you can pull it up, it goes back. My skin doesn't quite go back as old as I am now like it did when I was 21, but it still has elasticity and goes back. unfortunately, when you sustain your injury that's a burn injury, it denatures that collagen. So what we've come to expect along with our skin that has collagen and elastin no longer has that. It's more like a shoe that you've gotten wet and put it over to dry and then try to put it on. It just doesn't stretch. It doesn't do anything like you're used to.
You mentioned the severity of her burns. You've worked in the burn unit for a long time. Is this a normal case that you see in the burn unit?
No, sir, not at all.
Have you been able to view not only pictures that were taken from the crime scene, but also pictures that were taken from the autopsy of Jessica Chambers?
Yes, sir, I have.
And have you been able to describe those conditions for us, the burns in detail for us in looking at those photographs?
Yes, sir.
Your Honor, may I approach?
You may.
And Dr. Hickerson stand down.
He may.
Dr. Hickerson. These are photographs actually from the crime scene. Can you describe the burns that you've actually mentioned to us just now?
Yes, sir. What you see through here is all third-degree burns. This happens to be an electrode that's an EKG electrode. These burns through here, this may look like normal skin, but that's an extremely deep burn. That's the leather portion that we're talking about. You can see that same aspect down here on the face where all of this is leather. You can see the lips that are through here, the nose, all of that. The eyelids themselves, they lack the normal consistency of an eyelid in this picture because there's no creases. So all of that's just really stiff.
And that would have been
Yes, sir. The lips and all? Yes, sir.
lips, nostrils.
Yes, sir.
Now, and I know I asked this to the pathologist, and I've asked you before, especially the cleaned up views from the autopsy, along the torso area, it seems to be a normal color. You describe those to be as being some of the worst, is that correct?
Yes, sir.
And why is that?
Well, this, you can see the skin where it's just peeled back here, but all of this is leather. You can see some of the redness through here that has, where the blood has been fixed maybe within the dermis, but there's just nothing there. That's just all white leather underneath.
And that torso becoming like leather and not having any elasticity, would that affect her ability to speak in volume?
Yes, sir. To be able to speak, you have to get air in to be able to get air out.
And when you say get air in, are we talking about just taking a deep breath?
Yes, sir. Being able to breathe, move the air into your lungs, because the way you're going to be able to speak is to take the air and bring it back out through your vocal cords. Your vocal cords set up in the larynx, much like this, and they will come together and separate when you're trying to make sounds. The rest of the way that we make sounds is not only coming through those vocal cords, but also with the way that we move our lips and the way we move our tongue within our mouth. So if you're going to whistle, you put your lips in a certain position. If you're going to say different words, you put your mouth and your tongues in different positions. But you've always got to be able to get that air out. If you see someone that is having a lot of trouble breathing because of their lungs, and I don't know if you've ever been around that type of individual, but a lot of times they just can't get that air out well enough to be able to speak clearly. Then when you combine that with this type of picture, you're not going to be able to speak.
I'm going to get to her breathing and her ability to speak in just a second. The severity of these burns, several first responders on the scene actually mentioned that she was in shock. You know what I'm referring to when I say shock?
Yes, sir. There's a couple things that you can say when you're in shock.
And would you describe the types of shock and levels of shock for this jury?
Well, from our standpoint in medicine, a shock is not that you're surprised with anything. It's the fact that from a shock would be that you get this type of injury and psychologically, you're just in shock. I mean, you don't necessarily think thoroughly, but beyond that, you go into some of the phases that's more like a catatonic phase. But from a physiological standpoint, your shock is the fact that you're not getting the oxygen to your cells that you need. That can be because of infection. It can be because of blood pressure. It can be several reasons. And in a burn situation with this, your shock becomes several things. Number one, catecholamine levels, which are some of the things of fight and flight, go up. And your adrenaline, if you would.
Yes.
Okay? And that only drives you so far. But with that, you have to be able to get blood flow to your brain and to your heart. And when that decreases, then you go into that shock phase. You're not getting the air and the blood flow that you need to those organs, basically.
And in a situation like this, would one of the common thoughts be, I'm going to die?
It's the first thing. From a psychological standpoint, you have several phases that you can go through that I talk to the parents and families and patients about. But the first thing is, I'm going to die. If you get beyond that, then it goes into, wow, am I going to live, but am I going to live with everything that I've got? Will I have my hands? Will I have my feet? It becomes, will I be able then, if I've got all of these, to do what I would normally do? So there's several phases that they go through, but the first in this type of situation is, I'm going to die.
And given the severity of the burns, did she have any chance to live?
No, sir.
You've talked about the mental aspect from shock. This is obviously what I would consider a not very smart question, but I do want you to answer. What type of pain would this child have been in?
You know, it's really difficult to explain the type of pain because it's just too tremendous. You ever burnt your finger? Just taking a pan out of the oven? 20% of my body was burned. I had skin grafts to that aspect. And I can tell you when I had my burn, it was the worst thing that, I'd ever had. And to date, it's the worst pain that I've ever had. I've had, bones broken playing ball. I've had a colon that ruptured, a bunch of things, but nothing that would compare to the pain of that burn. And to have it to this extent, I personally could not even imagine what that would be like. It'd be tremendous.
Dr. Hickerson, this jury has actually heard from a speech therapist or speech pathologist already. And the way they describe normal speech works from the bottom all the way up to the top. I want to do the same with you in regards to her condition from the bottom all the way up to the top, okay?
All right, sir.
The next photograph I'm going to show you actually is a photograph from her rear area. And the first thing I want to ask you, we talked about some areas of her body that would be spared. And could you explain to the jury what you mean by spared?
We talk about sparing. This would be an area that's spared, where you see normal skin through here. And this would be where she was laying on something, but that area on the buttocks was spared. The rest of this all is third degree. to varying degrees. This just happens to be deeper and more of a tanning process, not suntan, but the leather that we're describing, that the skin is even further destroyed through here. You can see the outer layer of the skin coming off here. You can see sparing that would be to some parts of her scalp. But then you see others that have the burns that's within there as well. There's no sparing through here. All of that's burned.
Dr. Hickerson, these are two photographs from the top and bottom of her front torso and front of her legs. Can you describe these photographs for the jury?
Yes, sir. What you see here is the burns that we were talking about before on the on the legs. This area through here, which would be through the groin, has some areas that are spared, okay? All of this, third-degree burns. All of this, third-degree burns. This that looks white, third-degree burns. It's where that outer layer of skin has literally been pulled back like a glove. And you can see that where it's still on the fingers of the thumb. These cuts that you see were placed by Dr. Van Vliet in order to try to get her to have more air getting into her lungs. Once that skin is burned like this, then it's like putting a cast on. And you can try to punch air in, but it doesn't go anywhere because that skin is so tight. It's that leather again. So you put incisions down through here like this and cross, so that then you can try to get that air into the lungs so you can get more perfusion of the blood that goes through there picking up the oxygen.
I do want to ask you a question about the run report from MedStat, being the ambulance service. There was a statement that had been made earlier that breath sounds were clear and equal bilateral.
Yes, sir.
Would you explain that actual term in connection to what her body was going through?
Sure. Just because your lungs have not been damaged to the extent that they have asthma, that you're listening to wheezes, that there's not consolidation that would be from pneumonia, which you wouldn't expect at this stage. They should be clear, unless there's such a constriction of the upper airway that you have a stridor at their vocal cords. So she gets air in. It's not a lot, but she gets some air in. So the breath sounds will be equal from the left and the right, and they should be clear. Doesn't mean she's getting a lot of air in, but she's moving some air.
Due to the condition of her body, numerous firefighters have already testified that they almost had to get in her face to hear any sound she was making. Would that make sense?
Yes, sir, it would.
And can you tell the jury why?
Because again, we were talking about, remember that you got to get the air in, you got to get the air out. On some of your other pictures that you have, you see the face is just, it's basically like a mask because it's like this portion of her skin. It doesn't move. And each time we talk, again, my lips change, my cheeks change, so that I make different sounds along with my tongue. But I have to have the air coming out. And that's coming from your diaphragms, coming up through your vocal cords, and then out your lips.
To finish off with a question about the diaphragm, one of the firefighters said that, and a couple of firefighters talked about her position, but as they tried to lay her on her back, she couldn't breathe. They had to put her almost in a side or fetal position in order to get air.
Yes, sir. From a physiology standpoint, that's what I would expect, because this isn't moving much. And if you put someone on their back, then you got their entire weight coming down. So the back now is not going to move with you. On the side, it would be the easiest position that she could get in to move any type of air.
And you actually mentioned something to me about a bellows. Is that correct?
Yes, sir.
And tell the jury what a bellows is for those that don't know.
I bet everybody knows what a bellows is, where, you know, growing up, to get the fireplace started, we had the bellows that you used. okay? And you bring them apart, get the air in, push them down, get the air coming out. Well, the lungs are very simple, okay? They expand, they contract. And when we contract and push the air through, we can get air coming out that we make sounds with. So if you can't get that bellow expanded to bring the air out, you're not going to be able to force anything out through there to get any type of volume, okay? If you're going to yell, do you start with your lungs empty? I mean, every time I yelled at my kids, I took a good deep breath and shouted at them. Can't do that like this because you can't get that air in.
Dr. Hickerson, before I move on into the larynx and the vocal cords, there are some marks on Jessica Chambers' body that I asked you about specifically that are a different color than any of the burns, and they're directly below the breast and some spots along the abdomen or torso. Can you describe those marks?
These marks look more like bruising.
Would those marks be attributed to the fire?
No, sir.
To finish up with her body, one of the firemen actually described her as a zombie. You understand what I'm saying? They
Yes.
described her walking
Never
as
seen
a
one,
zombie.
but I understand.
We've actually heard the defense talk about how the fact she was walking. Could she walk?
She could walk.
How
but
would she be
It's not
walking?
going to be a normal gait. Because when we normally walk, we put our heel down, we spring through, we bend our knees, we move our hips. Likewise with our arms, we bend them. Before these cuts were placed, this is going to be so tight that if you tried to force those into a position that normally would be like this, you may even crack that skin. With the legs, it's going to be more that zombie walk because you can't bend them like you normally would.
And one of the first responders also talked about trying to get her to write something, and she could not close her arms. Would that be accurate in what you're seeing in these pictures?
Yes, sir.
As we move up out of the diaphragm, and you just mentioned air going into the larynx through the vocal cords, is that correct?
Yes, sir.
In the autopsy, they actually cut her airway so that they could get a good look at the larynx and the vocal cords. Is that correct?
Yes, sir.
Can you describe this picture for the jury and what you're seeing?
This is your larynx that's usually a tube. So it goes down through our throat into our lungs and then starts to branch out left and right. And what you're seeing from your cords down is the soot that is in here that would have been the carbon products that she was breathing in during the fire, which would mean to me it's in an enclosed space.
Would that be consistent with a car, vehicle?
Yes, sir. If you're outdoors, you usually don't see this type of picture.
If you were outdoors, would you normally see the severity of the burns that I've just previously shown you?
Not usually unless they were incapacitated in some way.
In regards to the larynx and the vocal cords, I believe the pathologist termed this as a heat injury. I believe you differ from her in that. Is that correct?
Normally, you're going to see this more as a chemical burn, the byproducts that are coming from that fire.
And would you explain to the jury the difference between what you would call a heat injury and a chemical injury? Chemical burn.
To get heat injury below your larynx, to those of us that deal with burns all the time, that comes with a few things. One would be superheated steam. The other would be where you're having surgery on your larynx and a fire occurs, which can occur when you use one of the electrocardiography devices and you're giving them too much oxygen during that time period, because that's going to propagate any flame that you get, any spark that you get. So then that could come down through the airway and give you an injury that would be associated with the flame and the heat. Normally what you see with these, and this mucosa being so red and irritated through here, is because of the chemicals that you breathe in during the fire itself.
And could these chemicals that you breathe in affect Ms. Chambers' mindset at all?
Oh, you know, sure. I mean, carboxyhemoglobin itself builds up, the carbon monoxide. And if you're in that type of environment for too long, the levels go up and then it affects your own mentation.
You mentioned of course, the burn we're dealing with in this case, more of a chemical burn in the vocal cords and the larynx. Where would you expect to find a heat injury?
Above those vocal cords, so within the mouth and then on your skin and all.
In this case, have you actually viewed evidence of a heat injury?
Yes, sir, I have.
Can you describe the evidence of heat injury that's depicted in this photograph?
What you have through the entire face is heat injury. Your lips are basically, when you look at this picture, it appears that everything is just shrunk back and you really don't have any lips. It's almost up through here, level with that skin, and you've got some splitting through here. And in addition, you see the tongue that has a burn on it.
And what type of burns would you categorize those burns in the face?
Those are 3rd degree, sir.
And you mentioned the lips would be leather.
Yes, sir.
As for the tongue, there was testimony earlier in a question from Dr. Barnhart that the internal examination of the tongue was atraumatic. And she testified that that means the blood was pumping, the blood vessels were flowing.
Yes, sir.
Now, does that make sense in regards to what you see?
Yes, sir. What you see here is that tongue's trying to swell back through here. You got the burn here also that's even deeper. And with that, with blood flow coming in, not getting out well, then this swells. So that's going to make that tongue even worse.
And as you've already talked about with her diaphragm, as you talked about with her larynx, as you talked about with her vocal cords, and you've discussed this picture right here, would all of these affect the speech of Jessica Chambers?
Without a doubt, sir.
And especially that tongue, would that affect the speech of Jessica Chambers?
Yes, sir.
And why do you say that?
Well, you have to have the tongue be able to move and to be able to pronounce anything, basically. You can make sounds, but to be able to make sounds that can be understood, that would be very, very difficult.
In your expert opinion, based on a reasonable degree of medical certainty, do you believe that Jessica Chambers could have been speaking?
Not with what I see here, sir.
Would that tongue have moved?
Very little.
And it was flowing?
Yes, sir.
And those lips were solid?
Yes, sir.
You also mentioned this burn coming in a closed space. Sorry,
Yes,
you have to respond for the court reporter.
Yes, sir.
And we do know the chemical that we're dealing with is gasoline. Are you familiar with the gasoline burn?
Yes, sir.
For Jessica Chambers to sustain these type of injuries from a gasoline burn in a closed space, can you testify as to your expert opinion to a reasonable degree of medical certainty how long she would have been exposed to this heat?
I would say some 3 to 5 minutes would be a time period that would take to get to that temperature to get that type of burn.
3 to 5 minutes is a long time to sustain a burn. Am I correct?
Yes, sir.
When you were burned, what is the first thing you do?
Try to get away from the source of the fire, sir.
for her to stay there 3 to 5 minutes, could that be consistent with her being unconscious?
Could be, yes, sir.
The speech pathologist testified as to her expert opinion that in order to cause the burns that we're looking at now, she would have been exposed to that heat for roughly 2 to 3 minutes.
Okay.
Is that consistent with your expert opinion here?
Yes, sir.
You've seen the pictures from the crime scene. You've seen the photographs from the med. You've also seen the photographs from the autopsy. When would Jessica Chambers had sustained these, when would Jessica Chambers' burns get to this level?
Within 3 to 5 minutes.
Would she have had third-degree burns and the leathering and the solid tongue when she came out of that car?
Yes, sir.
You're going to hear I'm sorry, you're not going to hear testimony, but there's been talk about her conditioning being okay to where she could speak and then worsening over time.
Occasionally that will happen. In what I'm seeing in these pictures, I don't think that is the case, sir. And I see an awful lot of burns.
And is that due to the third-degree nature of the burns?
It's the extensive third-degree burns in this case that also includes the tongue.
The testimony from some of the first responders said they thought they heard cold when she said, oh. They thought they heard Eric when she said, eck. What type of sounds do those sound like to you?
I think the guttural sounds that she would make may be interpreted as things, but it would be more of a type sound and wouldn't be anywhere near that loud.
More pain sounds?
Pain sounds, yes, sir.
Dr. Hickerson, the last thing I want to ask you about, you just talked about adrenaline. Adrenaline. We've all heard stories about how people do things that they could not normally do when they have adrenaline. Is that correct?
Yes, sir.
And I also want to ask you about desire, because there were several first responders that said Jessica was trying to communicate with them.
Yes, sir.
Do you believe that was the case?
Yes, sir.
Now, given the adrenaline she had and given all the desire in the world that she had to communicate with these first responders, which I have no doubt she did, would she have had the ability to communicate with them?
No, sir, not in my opinion. She's going to be more like a person that's had a stroke. And they have all the desire in the world to communicate and talk to you, to be able to move, to be able to do certain things. But I think that's where Jessica is going to be right now. She may have the desire, but I don't think she is going to have the way to accomplish that goal.
Is that based on her physical problems?
Yes, sir.
Got our tenor of the witness. Dr. Hickerson, you can take the witness stand.
Thank you.
All right, you may cross-examine.
Took some water.
If you've got some, that'd
Oh, I
be
got
awesome.
some.
Thanks, Judge.
Yes, sir.
Appreciate it.
Yes, sir.
Court's indulgence, just a moment, Your Honor. Good afternoon, Dr. Hickerson.
How are you, ma'am?
Great. Would you say that medical sciences something that would be a 100% certainty in all cases?
No, ma'am.
Okay. And I know you just testified momentarily that occasionally there are times when burns may worsen over time. Occasionally?
Yes, ma'am.
Okay. So I believe your opinion is that the young lady, she did not speak. Is that your opinion?
I don't think that she spoke intelligibly to where anyone could be able to understand what she was trying to say.
Okay. So as far as her speaking intelligibly, I'm not sure if you're aware that there were indeed firefighters and other first responders on the scene, at least 10 individuals who spoke with her at different varying times. And they indeed said she said a name. Are you aware of that at all?
I've heard that that's what has been said, but when I look at those pictures, and I understand where you say that science is not 100%, but there are times when you can say, not going to happen. And when I look at those pictures, between the tongue, the cheeks, those lips, and the lips, I mean, everything about that face is just a plastered back face where it's leather. And that's not going to develop like that over an extended period of time.
So I believe you stated that she could walk with those type of burns, correct?
But she didn't walk normally.
She walked though, correct?
Yes, ma'am.
Okay. May not have been normally, but she did walk. And I believe your testimony was that she walked likely away from where the fire source was.
I certainly would.
Okay. Certainly, I would too. And in this particular instance, are you aware that she was not walking from the car? She was actually walking towards the car. Were you aware of that?
No, ma'am. But with the confusion with which she could be, if she had originally walked away from the car, she may walk back toward it.
Could be, and that would have been a lot of walking she would have been doing in the midst of burns she had sustained. Do you agree with that?
To a certain extent, I think I see where you're headed. But in this situation, I'm not sure how far, how long, get away, come back would be, because in her situation, at this stage in the game, the energy source that she may have from her adrenaline even that you've referred to would be pretty high. So with confusion, or even if there was someone now that was at the scene where she could come back to, would be possible if she's trying to get help.
Yes. And so this possibility, again, we would look at the fact that there is absolutely no instance of something being 100% medically certain, correct?
I think you're talking about two different aspects though, ma'am, because with your ambulation, we're referring to large muscles. With our speech, we're talking about much smaller muscles that move our tongue, our lips, to be able to get those things accomplished. So I think in this situation, you're probably comparing apples and oranges.
Okay. Well, let's look at the apples first. Let's do that. If we say that there are 10 persons who heard her say a name as well as Eric set me on fire, also other type of statements that were made that were indicated in reports that were in quotes, because that is what those 10 individuals heard and documented. And for you to say that she did not speak, would you change your opinion if those individuals said that that's what they heard?
No, ma'am, in this case, I wouldn't. I've been doing this an awful long time. I've heard a lot of statements that have been made about how the person was, is, and things of that nature. And if you've never been in this type of situation, the people that are at that scene seeing something like this, with as long as I've been doing this, and if we want to add up the years between residency and practice, we're hitting close to 40. That this is very,
I'd like to ask you just to hold on a minute, please.
all right,
Just let the train do its thing.
train's getting some air.
Jury would like to stand up for a minute. In the courtroom too, if you want.
Can you set your clock back?
I don't think so. It got us yesterday afternoon also, but,
Yes, sir, Your Honor.
What I was trying to say
Yes.
is that for those individuals, there's a shock phase as well. They've not experienced this. And they're going to try their best to adhere to anything that they could with that. And I hear you. I'd like to think that maybe she could have, but in all honesty, ma'am, I can still tell you that with my medical opinion, that that would not be the case.
And so the fact that you just testified to that occasionally that will happen, why would your opinion not take into account the individuals who were there on the scene?
Occasionally, what would happen, ma'am?
Her speaking.
I think she would try to speak, but with what I'm seeing from a physical standpoint on her pictures would be that she has a desire, but the ability to do so to where she could be understood, I don't think is going to happen.
So just in conclusion to the speaking aspect of it, your position is that she could have spoken, but just not intelligibly.
She could have made sounds, but not sounds that we would be able to say would be speech.
Despite the fact what all of the other reports have indicated.
I'm just telling you what I see, ma'am.
Okay. And I believe that there was discussion about, well, let me do this. Are you aware of, in any way, at the point when the first responders got to the scene on that day? Do you know what that time was?
No, ma'am.
Okay. If I say to you that it was about 8:16, and then the arrival at the Med Center would have been right at about 10 o'clock.
Okay?
Okay. Would that qualify as one of those instances where the condition would worsen through time, because that would appear to be at least an hour and a half later?
Normally, for that to have occurred, she would have had fluid resuscitation. They were not able to get fluids in her.
So normally for that to have happened, is what you're saying, is there would have had to have been fluid resuscitation.
Normally for our burns, what happens, and you'll see the progression of a lot of their edema and things, is because they're getting a lot more volume in, because they lose fluids. When we have a burn this size, okay, we go by what's called the Parkland formula. At that stage, back at that time, we would have used 4 cc's per kilogram per percent area burn. All right? So she's 90% burn. Multiply that by 4, okay? And then multiply that by her weight. And that would tell us how much fluids we're going to give her within the first 24 hours. Half of that would be given in the first 8. So basically, she would get, you know, if we were to multiply that out, 360 times, what did she weigh?
I believe about 100 pounds.
So 50 kilos or so,
104.
make it easy, okay? She would be getting over 15 liters worth of fluid, okay? 15 of your big IV bags that you normally see. And in someone that comes out of surgery, what you would do, they may get 1.5 a day. So that's why they swell so. And that's why you have that progression of what you would normally see. In this situation, since she didn't get that type of fluid, she's going to stay up the same aspect of what she had at the time of her injury.
And so again, that would be operating under 100% medical certainty.
No, ma'am, that's under normal case scenario.
Okay.
And that's time after time after time. That one's not going to vary for you.
So my problem is this, Dr. Hickerson, when we're looking at medical science not being something of perfect certainty, and let me direct you to how you spoke about physiologically, she went through something in her last moments. She thought, I'm going to die, correct? Okay. Wouldn't you say that there are people diagnosed with cancer even, and they survive, but it could be terminal cancer, and they are completely cured? In this instance,
Terminal cancer, I don't think is cured, ma'am. Those terminologies are mutually exclusive.
okay, a person has cancer, and then the diagnosis is that it is terminal,
Okay?
and then for some reason, they're healed after that. Are you saying that's not possible?
Didn't say that.
Okay, I'm asking, did you?
No.
Okay.
That's not what I
Clarify that
said
for
with
me.
what you were comparing there. But
Okay.
again, we're going back comparing apples and oranges,
Okay,
okay? There's certain things that are going to happen. There's a certainty. I guess what's the old adage that we have? Nothing's certain but, you know, taxes and death. Okay? Some people try to skirt both of those. But in medicine, I agree with you that there's some things that may or may not happen. There's other things that are going to happen. And with what we're describing here, in my opinion, after having done this for all this length of time, seeing thousands of patients, this one is a certainty.
in dealing with your opinion that it was certain she was going to die, that's certain, correct? Okay, but as far as her speaking before she died and the physiological part that she was going through?
I'm afraid, ma'am, that I'm going to have to answer in the same way.
Okay.
We can go through these scenarios, but from what I am seeing for you, I am trying to give you my best opinion that that's where we are, that it doesn't change. And her facial appearance, her burn, I'm not trying to be dogmatic with you. I'm trying to be honest, okay? And before I stepped up on this stand, I raised that right hand. That's where I was. And this is what I'm trying to be for you. My mama didn't raise no liar. And in this court of law, it's definitely not going to be.
Well, I certainly don't want you to feel like I'm wanting you to lie. I just want to, what I'm asking is that, and I've stated it several times, medical science is not a 100% certainty type field. You've agreed with that, correct?
Yes, ma'am.
Okay. And so, having said that, as I go through the physiological aspects of what you testified to earlier, I'd like to address it with you. And then you tell me, Ms. Palmer, hey, this is my answer. Can we do that? Okay. You said, I'm gonna die. That's what she went through, which you feel, in your opinion, she went through as she had experienced her burns, correct? That's one of the first things she thought.
Yes, ma'am.
Okay. And then, will I live?
No, ma'am.
Okay.
Not in this case.
Okay.
Okay?
So she wouldn't have thought that.
I don't think she's going to thought, will I live?
Okay.
In her situation, again, this is one of those that I gave you the scenario about as you progress through burns, what people will think, okay?
Yes.
Now, not everybody thinks I'm going to die,
Correct. I agree with
okay?
that.
In this type of situation, though, with these type of burns, I would not know anyone that would not think they were going to die.
Okay. Fight or flight, I believe you spoke about that.
Gentleman by the name of Hans Selye was the first one that described that.
Okay. And so the fight part of it, if you allow me to give you an example, and then you tell me if you agree with that or not, okay? Of the fight and flight.
All right?
Would you not think, in your opinion, that she would want to convey who did this to her?
Oh, I think that you probably would.
Okay. Or she would want to convey who did this to her, correct? Okay. And so, considering the fact that she had been asked by several individuals to convey that, would that not fall into one of those instances where you said occasionally that will happen and there will be some type of, or let me rephrase it, in this instance, she would want to, this would be an occasion where this may happen, where she is conveying intelligible speech.
What I said was that I felt like she'd probably want to tell. But if you recall after that, I compared that to the person that had the stroke, where they want to convey that. And I don't know if you've ever been around those that had an expressive aphasia,
I have.
that they really want to, but they just can't tell you.
As far as, in this instance, I'm certain of this, but you weren't present on the scene, correct? Okay.
No, ma'am.
All right. And so you did not have an opportunity to personally hear any type of recitations or statements that she made while at the scene, were you?
No, ma'am.
Court's indulgence, just a moment, Your Honor.
All right.
You can't say with absolute certainty that she was in a particular position at the time she sustained those burns, can you?
If you look at those burns, it looks as if she was probably in a sitting position.
Okay. She suffered burns to her back as well as the back of her legs. Would that indicate any other position to you, like a standing position?
No, ma'am. The soles of her feet are spared, which could be a standing, but the buttocks were also spared, where the rest was burned. So, you know, it looks to me as if that was the situation.
So if she were sitting, she sustained burns to the back of her leg?
You can, yes, ma'am, because if you have, depends upon the weight that you've got on your buttocks, where you're sitting and in contact with something. Like with my setting here, I've got air cells between my back and the back of the chair, between my thighs even I have some. But that would just be my opinion as to where the position she was in.
So no other possible positions, considering it was the entire front of her body and the entire back of her body, with the exception of the sparing on the buttocks, the bottom of her feet.
If she were standing, I don't see how the buttocks would have been necessarily spared, ma'am.
Well, what is your opinion as to the sparing on the buttocks? What would have caused the sparing to be as it was?
I think that's just the pressure that she had there. From the front, the sparing that you have in the groin could have been from a position of the arms at one point or anything else that could have been there. I'm not a forensic pathologist, but that would be my opinion.
Of course, indulgence, just one more.
Yes, ma'am.
I attended with Ms. Shawn.
All right, read the record.
Dr. Hickerson, if I'm correct, you categorize the injuries to the face and the mouth as immediate injuries. Is that correct?
Yes, sir. The pictures that I see there would not be one that's going to progress over time.
And you categorize as her sitting in that vehicle for 3 to 5 minutes.
Yes, sir.
And those injuries that she sustained, would she have been just like that when she came out of that car?
I believe so, yes, sir.
And I believe you and I agree and have no doubt that Jessica Chambers wanted to convey something out there on that scene?
I'm sure she did.
In your expert opinion, as to a reasonable degree of medical certainty, would she have had any ability to do so?
No, sir.
Your Honor, I have no further questions from Dr. Hickerson. I would ask that he be finally excused.
Dr. Hickerson, thank you, and your fine excuse, sir.
Thank you, sir.
Yes, sir. We're a little late in taking our afternoon recess, but I didn't want to interrupt these professional witnesses that have come down from Memphis, so that's the reason I pushed it a little longer. So I'm now going to put you in recess for our afternoon recess, all right? Well, let's try to be back in position by 4 o'clock, all right, and resume.